My name is Tracy. I'm a PT student. Do I have your permission to do some palpation on you and to record this for educational purposes?
Yes.
Perfect. What we're going to do now is find the suprasternal notch, which is if we find the clavicles and go inwards, we will be landing on the suprasternal notch. Inferiorly of the suprasternal notch, we will find the manubrium, which is a flat bone. Palpating more downwards, we will then feel a ridge. The ridge separates the manubrium, the flat bone, and the sternum body. We keep going down. It's the sternum body all the way down towards we get to a bony providence, which is the Seifert process. We want to be careful when doing CPR not to have our hand placement here in the Seifert process, but more towards the nipple line where the fifth rib is located. We will then go and find the first rib. The first rib, the splenic muscles are attached to the first rib. So the first rib we will try to find by palpating the muscles, and then we will ask our patient to take a deep breath. By this, we can feel the first rib rise. We will then find T3, a landmark, which we can see by finding the spinous scapula and going inward. Finding T3. From T3, it's right here. We will now find the rhomboid muscles. The rhomboid muscles from T3, we can go down and find T5, which is T4, and T5. The rhomboid muscles are basically from T5 till C7 in this area. They run diagonally, horizontally kinda, from the medial border of the scapula towards this area. We want to palpate vertically the fiber since it runs diagonally. In order to feel this contract, I will ask my patient if they can please place their hand behind their back and rise their elbow. We will then feel this muscle contracting. Thank you. We will then find the angle of the ribs. We can go by this by finding a random spinous process and going towards the side of it, finding the transverse. We will then palpate until we find a bony structure which is considered an angle of a rib. Going downwards more, we can palpate the shaft of the ribs, going down towards the 12th rib right here. If we go superiorly from it, we will then find the intercostal. Thank you.